somewhere between your last cup of coffee this afternoon and the moment your head hits the pillow tonight, there's a small window of opportunity. A choice you make almost every single evening without ever realizing just how much it might matter for two small, quiet organs working tirelessly inside your body right now as you listen to this. Your kidneys don't ask for much attention. They don't hurt when they're struggling. They don't send obvious warning signals the way your heart or your stomach might. They simply, quietly, filter your blood, remove waste, balance your fluids, day after day, year after year, often without a single complaint, until real damage has already begun. But here's something remarkable I want to share with you today. There's one particular fruit, backed by genuine research, that may offer your kidneys some meaningful support, particularly when eaten in the evening, before bed. It's not exotic, it's not expensive. You've almost certainly eaten it before, probably without ever knowing this connection existed. Stay with me through this entire video because before I reveal exactly which fruit this is, and why the timing may matter, I want to walk you through 6 other important things about kidney health that too many people over 60 simply were never told. Understanding these first will help you appreciate exactly why this final answer matters so much. Hello, and thank you for spending this time with me today. I'm Dr. Richard Williamson. I've spent more than 20 years working in emergency medicine, and throughout my career I've cared for patients at every stage of kidney health, from those with perfectly functioning kidneys who simply wanted to protect what they had, to patients managing chronic kidney disease, to those, unfortunately, who arrived in my emergency room with kidney function that had quietly declined for years before anyone noticed. I want to be honest with you from the very beginning of this video. Kidney health is genuinely complex, and it varies enormously from person to person depending on your overall health, any existing conditions like diabetes or high blood pressure, your medications, and your individual kidney function. Nothing I share today is meant to replace personalized guidance from your own doctor, particularly if you already have any diagnosed kidney condition or if you're on dialysis, since some of what I'll discuss, including fruit intake, requires very individualized guidance in those specific situations. With that said, for most adults over 60 without significant kidney disease, there's quite a lot of encouraging, practical information worth understanding, so let's begin our countdown. Number 7 on our list is understanding why your kidneys deserve far more attention than most of us give them. And I want to start here because this context matters enormously for everything we'll discuss afterward. Here's the science, simplified. Your kidneys, 2 bean-shaped organs located toward your lower back, filter approximately half a cup of blood every single minute, removing waste products, balancing electrolytes like sodium and potassium, regulating your blood pressure, and helping produce red blood cells. This filtering happens through millions of tiny structures called nephrons, and here's the part that surprises many people. Once nephrons are damaged, they generally don't regenerate. Unlike some tissues in your body that can heal and regrow, kidney damage tends to be permanent, which is exactly why prevention and early attention matter so significantly. As we age, kidney function naturally declines somewhat, even in healthy individuals. This is a normal part of aging. However, additional factors, high blood pressure, diabetes, certain medications, dehydration, and dietary patterns can accelerate this decline beyond what's simply expected with age alone. I think of a patient, a man I'll call Harold, 68 years old, who came to see me for a routine checkup, feeling generally well, with no specific complaints at all. Routine blood work revealed his kidney function had declined more than expected for his age, something that genuinely surprised him since he'd felt completely fine throughout. We discussed this together, and Harold, understandably, asked why he hadn't felt any symptoms if something concerning was happening. I explained something important. Kidney decline is often silent, particularly in its earlier stages, precisely because the kidneys are remarkably good at compensating, continuing to function reasonably well even as some damage accumulates, until a more significant portion of function has been affected. Harold's situation became a turning point for him, not a cause for panic, but genuine motivation to understand his kidney health more thoroughly and to make some thoughtful adjustments moving forward, adjustments we'll discuss throughout this video. I want to reassure you, if you've never really thought much about your kidney health before today, that's completely normal, and you're certainly not alone. Most people don't, precisely because kidneys work so quietly. But understanding a bit more, as we're doing together right now, genuinely empowers you to make informed choices going forward. Now, let's move to our sixth point, something so fundamental that it's easy to overlook entirely. Number 6 on our list is proper hydration, and I want to explain why this matters so significantly, more than most people realize, for kidney health specifically. Here's the simplified science. Your kidneys rely on adequate fluid to function properly, helping flush waste products through your urinary system effectively. When you're chronically underhydrated, even mildly so, your kidneys must work harder to filter the same amount of waste through less available fluid, similar to trying to rinse dishes with barely any water running. Over time, this added strain may contribute to kidney stress and is also associated with a higher risk of kidney stones, which can be quite painful and sometimes require significant medical intervention. As we age, our sense of thirst can become less reliable, meaning many older adults are mildly dehydrated without ever feeling particularly thirsty, similar to something we touched on in a previous conversation about morning habits. I recall a patient, a woman named Dorothy, 71 years old, who came to see me with recurring kidney stones, something that had become a frustrating, painful pattern over the previous 2 years. When we discussed her daily fluid intake in detail, it became clear she was drinking remarkably little water throughout her day, relying mostly on coffee in the morning and perhaps 1 glass of water with dinner. We worked together on a practical plan, not overwhelming her with an unrealistic amount all at once, but gradually increasing her water intake, keeping a water bottle visible on her kitchen counter as a visual reminder, and setting simple phone reminders throughout her day until the habit became more natural. Over the following year, working alongside her urologist to monitor her progress, Dorothy experienced a meaningful reduction in her kidney stone episodes, something she attributed significantly to this consistent improvement in her hydration habits. I want to reassure you, proper hydration doesn't require complicated calculations or expensive gadgets. A general guideline many doctors suggest is aiming for pale yellow urine throughout your day rather than dark yellow as a simple practical indicator of adequate hydration, though please discuss your specific fluid needs with your doctor, particularly if you have any heart or kidney conditions that might require different guidance. Now let's move to our fifth point, something involving a mineral most people only think about in the context of their blood pressure without realizing its deeper connection to kidney health. Number 5 on our list is sodium intake, and I want to explain the connection here because it runs deeper than most people initially realize. Here's the science, simplified. High sodium intake is closely associated with elevated blood pressure, and your kidneys are remarkably sensitive to blood pressure changes since they contain such an extensive network of small blood vessels, responsible for that constant filtering process we discussed earlier. Chronically elevated blood pressure can gradually damage these delicate blood vessels within your kidneys over time, potentially accelerating kidney function decline beyond what typical aging alone might cause. Additionally, high sodium intake specifically causes your body to retain more fluid, which increases the workload your kidneys must handle continuously day after day. Similar to asking a filter to process a consistently larger volume than it's designed to comfortably manage. I think of a patient, a man named Gerald, 65 years old, who enjoyed cooking and, admittedly, enjoyed quite a bit of salt in his cooking, a habit developed over decades. When his kidney function tests showed mild decline alongside elevated blood pressure readings, we discussed his diet in detail, and sodium intake became a significant focus of our conversation. Gerald, to his credit, didn't resist this conversation. He asked directly what changes might genuinely help. We talked about practical strategies using herbs and spices more generously to build flavor without relying primarily on salt-reading nutrition labels more carefully, since processed and packaged foods often contain surprising amounts of hidden sodium, and gradually reducing salt in his cooking over several weeks, allowing his palate time to adjust naturally rather than making an abrupt, difficult change all at once. After about 4 months of these consistent adjustments, alongside continued monitoring with his doctor, Gerald's blood pressure had improved meaningfully, and his kidney function tests showed some encouraging stabilization as well. I want to reassure you, this doesn't mean eliminating salt entirely, or that food needs to feel bland and unenjoyable going forward. It simply means becoming more mindful of overall sodium intake, particularly from processed foods, which contribute far more sodium to most people's diets than salt added during home cooking. Now, let's move to our fourth point, something that connects two organs you might not immediately think of as being so closely linked. Number 4 on our list is blood sugar management, and this connection between blood sugar and kidney health deserves real understanding, particularly for anyone managing diabetes or prediabetes. Here's the simplified science. Elevated blood sugar levels, over time, can damage the small blood vessels throughout your body, including, quite significantly, the delicate filtering structures within your kidneys. This is actually one of the most common causes of significant kidney damage worldwide. Diabetes-related kidney disease, sometimes called diabetic nephropathy, develops when consistently elevated blood sugar gradually impairs the kidney's filtering capability over months and years. I recall a patient, a woman named Susan, 69 years old, who had been managing type 2 diabetes for over a decade, but admitted her blood sugar control had become somewhat inconsistent in recent years. Various life stresses had made her less diligent about monitoring and managing it as carefully as she once had. Routine testing revealed some protein in her urine, an early indicator that her kidneys were beginning to show some strain, likely connected to her blood sugar patterns. This finding, understandably, concerned Susan significantly, but it also became a genuine turning point for her. Working closely with her doctor, Susan recommitted to more consistent blood sugar monitoring, adjusted her medication timing with her doctor's guidance, and made some dietary changes to support more stable blood sugar throughout her day. Over the following year, her kidney function tests remained stable, and the protein levels in her urine improved noticeably. I want to reassure you, if you're managing diabetes or prediabetes, consistent blood sugar management genuinely matters for your kidney health specifically, not just for the reasons you might already be familiar with. And if you've experienced some inconsistency with your own management, as Susan did, please know it's never too late to recommit, and meaningful improvement remains genuinely possible with consistent effort and proper medical guidance. Now, let's move to our third point, something involving medications many people take regularly, often without realizing there's a kidney connection worth understanding. Number 3 on our list is being mindful of certain over-the-counter pain medications, specifically a category called NSAIDs, which stands for non-steroidal anti-inflammatory drugs, including common medications like ibuprofen and naproxen. Here's the science, simplified. These medications work partly by reducing certain compounds in your body that also happen to help maintain healthy blood flow to your kidneys. When taken occasionally, for a headache or minor discomfort, this typically isn't a significant concern for most people with healthy kidneys. However, regular frequent use, particularly over months or years, especially for chronic pain conditions like arthritis, may place additional strain on kidney function over time, particularly in older adults, whose kidneys may already have somewhat reduced reserve capacity simply due to aging. I think of a patient, a man named Frank, 72 years old, who'd been managing chronic knee arthritis for years and had grown accustomed to taking ibuprofen almost daily, sometimes multiple times per day, to manage his discomfort, without ever discussing this pattern specifically with his doctor. When routine blood work revealed some decline in his kidney function, we discussed his medication use in detail, and this frequent NSAID use became an important focus of our conversation. Frank, understandably, felt frustrated, since this medication had genuinely helped his pain, but he also wanted to understand safer alternatives moving forward. We worked together alongside his doctor to explore other approaches for his arthritis pain, including topical treatments applied directly to the joint rather than taken orally physical therapy, and in his specific case, a different oral medication with less impact on kidney function better suited to his individual situation. I want to reassure you, this doesn't mean these medications are dangerous for everyone, or that you need to avoid them entirely if you occasionally need them for minor discomfort. It simply means, particularly if you find yourself using them frequently or regularly, having an honest conversation with your doctor about your specific pain management approach and whether your kidney function should be monitored more closely, or whether alternative options might serve you better long term. Now, let's move to our second point, something that ties together much of what we've already discussed into one practical, everyday habit. Number 2 on our list is regular kidney function testing, and I want to explain why this matters so significantly, particularly given how quietly kidney decline can progress. Here's the practical reality. Kidney function is typically assessed through simple blood and urine tests, checking markers like creatinine, which helps estimate your overall filtration rate, and looking for protein in your urine, which can be an early indicator of kidney stress. These tests are often included in routine annual blood work, but I've found throughout my career that many patients don't realize kidney function is even being assessed or don't ask about their specific results in detail. I recall a patient, a man named Michael, 67 years old, who'd been receiving annual blood work for years as part of his routine checkups, but admitted he'd never specifically asked about his kidney function results, simply trusting that his doctor would mention anything concerning. When we sat down together and reviewed his results over several years side by side, we noticed a gradual, subtle decline in his kidney function. Nothing dramatic in any single year, but a clear pattern when viewed across time. This gradual pattern hadn't triggered any single alarming result, but viewed together, it told a more complete story worth addressing proactively. We discussed this pattern together and identified some contributing factors, including his blood pressure, which had been borderline elevated for years without aggressive treatment. Working together, we addressed his blood pressure more thoroughly and began monitoring his kidney function more closely, checking every 6 months rather than simply annually to track his progress more carefully. I want to encourage you, genuinely, to ask your doctor directly about your kidney function numbers during your next visit, rather than simply assuming everything is fine if nobody specifically mentions it. Ask what your creatinine level and estimated filtration rate are. Ask whether any protein has been detected in your urine, and ask how these numbers compare to your results from previous years. This simple, proactive conversation costs nothing extra and provides genuinely valuable insight into a pattern that single results alone often can't reveal. And now, we've arrived at the answer I promised you at the very beginning of this video. The specific fruit that research suggests may offer meaningful support for kidney health, particularly when eaten in the evening. Number 1 on our list. The fruit itself is the blueberry, and I want to walk you through exactly why this particular fruit has earned genuine attention in kidney health research, and why evening timing specifically may offer some added benefit. Here's the science, simplified as much as possible. Blueberries are rich in compounds called anthocyanins, the pigments that give them their deep blue-purple color, and these compounds have been studied for their antioxidant properties. Antioxidants help neutralize something called free radicals, unstable molecules that can contribute to cellular damage throughout your body, including within the delicate filtering structures of your kidneys, over time. Research has associated diets rich in antioxidant-containing foods, including blueberries, specifically with potentially reduced oxidative stress in kidney tissue, and some studies suggest this may be associated with better maintained kidney function over time, particularly in the context of an overall healthy dietary pattern. Additionally, blueberries are relatively low in sodium, and compared to many other fruits, moderate in potassium content, which matters because very high potassium intake can be a concern specifically for people with more advanced kidney disease, whose kidneys struggle to properly filter and balance potassium levels in their blood. For most people without significant kidney disease, potassium from whole foods like blueberries is well tolerated and offers genuine nutritional benefits. But I want to emphasize clearly if you have diagnosed kidney disease, particularly more advanced stages. Or if you're on dialysis, please discuss your specific fruit intake, including blueberries, with your nephrologist or renal dietitian, since your individual potassium needs may differ considerably from general guidance. Now, here's the part about evening timing that I find genuinely fascinating. Some research suggests that antioxidant-rich foods consumed in the evening may align well with your body's natural repair processes that occur more actively during rest and sleep. Additionally, and this is a more practical consideration, choosing a naturally sweet, satisfying food like blueberries in the evening, rather than reaching for processed, sugary snacks that often accompany evening television watching or relaxation time, may indirectly support kidney health by reducing overall sugar and processed food intake during a time when many people are most prone to less mindful snacking. I want to be genuinely honest and balanced with you here, as I have been throughout this entire video. Blueberries are not a magic solution, and no single food, eaten at any particular time, guarantees protection against kidney decline. Kidney health, as we've discussed throughout this entire countdown, depends on many factors working together: hydration, blood pressure, blood sugar management, medication awareness, and regular monitoring. All matter considerably more than any single dietary addition alone. Let me share a patient story that illustrates this balanced picture well. A woman named Eleanor, 70 years old, came to see me interested specifically in dietary changes that might support her kidney health. Since she had a family history of kidney disease and wanted to be proactive about her own prevention efforts. We discussed her overall approach together, addressing her blood pressure, which was well managed already, her hydration habits, which needed some improvement, and her overall dietary pattern. Alongside these broader changes, Eleanor began incorporating a small handful of blueberries most evenings, replacing a previous habit of having cookies or ice cream while watching television at night. Over the following year, working alongside her doctor with regular monitoring, Eleanor's kidney function remained stable, and her overall health markers, including her blood pressure and blood sugar, showed meaningful improvement as well. I want to be clear, I can't attribute this positive outcome to blueberries specifically. Eleanor made numerous positive changes simultaneously, and her improved hydration and blood pressure management likely played the most significant roles. But she told me, genuinely, that this small evening habit felt like a meaningful, enjoyable part of her overall commitment to her kidney health, something that felt sustainable and satisfying, rather than restrictive or burdensome. I want to reassure you if you'd like to try incorporating blueberries into your evening routine. A simple half cup to 1 cup serving, perhaps with a small amount of plain yogurt if you enjoy it, makes a wonderfully satisfying, naturally sweet evening snack. Fresh or frozen blueberries both offer similar nutritional benefits, so whichever is more accessible or affordable for you works well. And again, if you have any diagnosed kidney condition, please confirm appropriate fruit intake and portions with your doctor or renal dietitian first, since your individual situation may call for more specific guidance. Let's bring everything together now because we've covered quite a lot today, and I want this to feel clear, practical, and genuinely encouraging for you. We talked about understanding why kidney health deserves real attention, since decline often happens silently, without obvious symptoms. We talked about proper hydration, giving your kidneys adequate fluid to filter waste effectively. We talked about sodium intake and its connection to both blood pressure and kidney workload. We talked about blood sugar management, particularly important for anyone managing diabetes or prediabetes. We talked about being mindful of frequent NSAID use and having honest conversations with your doctor about pain management alternatives if needed. We talked about the genuine value of regularly reviewing your kidney function test results with your doctor, rather than simply assuming everything is fine. And finally, we talked about blueberries, a naturally antioxidant-rich fruit that research suggests may offer meaningful support for kidney health, particularly as part of a thoughtful evening routine. I want to leave you with something important before we close today. Your kidneys have been working quietly on your behalf for your entire life, filtering, balancing, protecting, without ever asking for recognition or attention. Today, I hope, is a small turning point, an opportunity to offer them a bit of thoughtful attention in return. You don't need to overhaul your entire diet and lifestyle overnight. Instead, I'd invite you to choose just one thing from today's video. Maybe it's finally asking your doctor directly about your kidney function numbers at your next appointment. Maybe it's keeping a water bottle more visible throughout your day. Or maybe, quite simply, it's picking up a small container of blueberries during your next grocery trip and enjoying a small handful this evening before bed. Whatever you choose, please know, small, consistent care for your kidneys, practiced patiently over months and years, genuinely matters, even though these quiet organs rarely announce their needs loudly. I also want to remind you sincerely that everything shared today comes from general medical understanding and clinical experience, and it's meant to inform and support you, not to replace personalized guidance from your own doctor or a renal specialist, particularly if you have any existing kidney condition, diabetes, or blood pressure concerns. Please bring up anything from today's conversation that resonates with your own situation during your next visit. If this video gave you something valuable today, even just one small change you're planning to make, or simply a new appreciation for these quiet, hardworking organs, it would genuinely mean a great deal to me if you'd give it a like. It helps this information reach more people who deserve clear, honest, medically responsible guidance. And if you'd like more videos like this one, honest, practical, and made specifically with adults over 60 in mind, please consider subscribing. I create this content because I sincerely believe you deserve better, clearer health information, delivered with genuine warmth and respect. I'd also love to hear from you in the comments below. Did you already know about this connection between blueberries and kidney health? Or is there one small change from today's video you're planning to try this week? Your experience genuinely helps other viewers feel more informed and less alone in caring for their own health more than you might realize. Take gentle care of your kidneys this week. Drink a little more water, ask your doctor about those numbers, and maybe, tonight, enjoy a small handful of blueberries before bed. And I'll see you again very soon, right here. Until then, I'm Dr. Cron, Richard Williamson, wishing you good health and quiet, steady strength from the inside out.